The World Health Organization reports that 1 in 4 people in the world will be affected by mental disorders at some point in their life. Bipolar disorder is ranked amongst the top mental health disorders in Kenya, and amongst them is Robert Njenga, who uses his talent in drawing and singing and beadwork to try and sustain his family. So how does one family survive in a society with mental illnesses such as this? Well, the BBC's David Wafula caught up with Njenga at his home and brings us this report.
Everything is gonna be...
With an album already out, Robert uses music as therapy to overcome depression.
Before I went to the hospital, I decided to commit suicide. When I told my mother and my brothers, they were afraid of that and frightened of that, and they told me, now we will take you to the hospital. But the way I was making bags and having my medication, my life was normal, like other. Even nobody can point to me and tell me that this man is sick.
Despite the stigma surrounding the condition, his wife says she has no regrets.
Sometimes people may mock you and tell you that you married a husband who is not in his right mind. Because I know him well, I don't listen to what people say. I believe we are going to live more years together and have more children.
Compared to other conditions, mental health disorders are not given as much attention, and there's lack of awareness amongst the public.
According to the World Health Organization, more than 800,000 Kenyans suffer bipolar disorder. And this shines the light on whether the government is ready to deal with mental health in a country where there are only 88 registered psychiatrists.
Managing extreme mood swings can really be a tall order for not just family members, but also health workers. Robert gets treatment at this mental health clinic about 10 kilometers from his home. Martin Wathika, a psychiatric nurse here, explains some of his difficult encounters with patients.
They want to talk so much. They want to be listened to. They are a little bit irritable. So a patient who's like that, they are really, really violent sometimes. So it takes time to actually be able to assess this patient, be able to calm them down so that you can be able to manage them.
In a country where mental health is allocated just slightly above 1% of the national budget, Robert can only hope that healing is on the way for people living with similar conditions who may not be as lucky as he is. David Wafula, BBC, Nairobi.
Well, joining me to talk about some of these issues raised in the report from Nairobi is the counselling psychologist Christina Lenju. Thank you for joining us. Let's just start by you explaining perhaps what specifically bipolar disorder is and what kind of treatment it entails.
Okay, bipolar disorder is a brain disorder. So it is characterized by extreme moods. So you have the manic phase and the depressive phase of the disorder. So basically, someone experiencing bipolar disorder may either have a manic episode whereby the mood is elevated, or have a depressive episode whereby the mood is very, very low. Yeah.
And what kind of treatment might a person need?
The most effective treatment is basically combining medication and psychotherapy, which you call talk therapy. So a person with bipolar disorder could be given mood stabilizers to stabilize the moods, as well as antipsychotic medication. And then the person needs psychotherapy for psychosocial support. Yeah.
I mean, we heard there in that report from Robert's wife just some of the stigma that she had faced. Also, Robert himself talking about some of the things that he had been battling with. How do you begin to change that?
Basically, to change stigma, a lot of public education is needed. We need to create awareness for people to understand that bipolar is a disease like any other. So we need a lot of public education and awareness. And we also need a lot of family support as well as community support to fight the stigma.
I'm really pleased you brought up family support, because very often the families get forgotten. What kind of support is available where you are at the moment?
For families, we have counselors who can psychoeducate families on the disorder. We also have various organizations that deal with mental health that can also educate the families. And we also, as counselors, we also have family therapy, whereby we have a sitting with the family members and you explain to them conditions. You explain to them what happens with the disorder and how to handle such a person, how to manage the person, and how to support this person so that the person can lead a healthy life.
You mentioned there, both in terms of helping the families and helping patients as well, things like talking treatments, excuse me, and also a medical treatment as well. But the cost of this, how prohibitive is it? Or are there places people can go and get this kind of stuff at a reasonable price or even for free?
Yes, medications for treating bipolar are available in public hospitals. They're also available in private psychiatric hospitals. The only problem is that depending on the economic situation of the patients, some patients may not be able to afford these medications, in as much as some of the medications are subsidized in the government facilities. But nevertheless, the medications are available in the public facilities. And then in the private facilities, we also have the second generation medication that works better and has less side effects. So the people who can afford that are able to access their medication.
All right. Christina Lenju, we really appreciate your time. Thank you for joining us here on Focus on Africa.